Please welcome to the stage Chip Lyons of the Elizabeth Glaser Pediatric AIDS Foundation and our esteemed panel.
Let me sit next to you.
Good morning, everyone. It's a pleasure for all of us. I've been speaking with my fellow panelists and colleagues to be here this morning, and we just very much appreciate your being here as well. My name is Chip Lyons. I am the president and CEO of the Elizabeth Glaser Pediatric AIDS Foundation, an organization that has, for that period of time, fought to try and get to a point where we can end HIV and AIDS in children, youth, and families. We've made tremendous progress to that end. But we don't want to make the mistake that we often do in public health, which is to declare premature victory. And so we're at a stage where we have to do things differently. We have to innovate. We have to be smarter. We have to hold people's attention. I will remind everyone with HIV and AIDS, in the absence of a cure or a vaccine, HIV and AIDS is going to persist. And if our services aren't sustained, if our attention is drawn in other directions, the virus will return. We can't let that happen. Our purpose in being together and having this I'm comfortable saying expert panel with us, is to think about how we use artificial intelligence and other innovations to get closer to that point of actually having a generation free of HIV and AIDS, and AI in its applicability towards closing global health equity gaps. We at EGPAF, this is near and dear to our heart. The response to HIV and AIDS over the decades has been one of iteration and innovation. And really that is what is going to be required to close the existing gaps. And let us all recall in this town, at the UN high-level meeting, the SDGs include ending HIV and AIDS as a public health crisis by 2030. That's 7 long years away. In our view, that's 7 minutes away. Now is the time to act further to try and close that gap. Towards that end, EGPAF has created an innovation incubator precisely to be able to partner with the private sector to bring the ingenuity, the ideas, and so on to bear that can help us close the gap around HIV and AIDS, but particularly for children. So we don't have a lot of time. I want to get the panel speaking so we can hear from them. We have 3 terrific individuals. We've agreed in the back. I'm dispensing with all the, this is what they did, then, there, and how. These are 3 folks we want to hear their ideas and reactions. First is Her Excellency, the First Lady of Namibia, Monica Gengos. Second is Bill Weeks. Dr. William Weeks is the Director, AI for Health at Microsoft. And Dan Diasio is the Global Consulting AI Leader at Ernst & Young. Madam Gengos, we've talked a lot. We work together on a few things. I want to just open it up for you to expound. Is it possible to end AIDS for children on the continent?
It absolutely is, and that's why it's so heartbreaking that we've allowed children to fall behind in the HIV response. It is possible, if you want a first answer.
Good, I'm encouraged. I'd be heartbroken if you said otherwise. You've done so many things. You're the co-chair, which is also dear to my heart, of something called Africa Reach, the founding premise of which is, with all due respect, and we need them, the voices and the leadership from Geneva, New York, and Washington, and so on. In the view of some of us, African leadership, African voices, African solutions are essential have always been, and they've been there, but to be given the space really to drive the next phase of the response. Can you tell us a little bit, because you're connected to several of those kinds of initiatives? What's working? What encourages you?
So what encourages me, I mean, just the experience from Africa Reach, and just context for the audience. Africa Reach is, it's a group of powerful African voices from all sectors of African society, from all parts of the continent, who are lending their very powerful voices and in the places that they occupy to speak to the issues around pediatric HIV. And what encouraged me from the get-go, I'm the chair of that body, was the absolute willingness and eagerness of all these different people to utilize their platforms and their voices in furthering this agenda, and how we've managed to really get the numbers involved in terms of just putting HIV back in the spotlight and on the agenda from unlikely people. Second, talking about unlikely partners is probably first ladies. First ladies have a lot of social capital, and like with all forms of capital, you must use it. And the Organization of African First Ladies is currently having a continent-wide campaign called the We Are Equal campaign, and it's running for 12 months, and it's launched in every single African country where there's a member First Lady. And our target, which is a realistic target, is to reach 700 million Africans through this campaign. And what encourages me there is that we have this concept that only governments, only these big partners, the global funds, the PEPFARs, can do meaningful work in terms of community mobilization. And the truth is we all can. We must find where our voices are, where our impact is, where our reach is, and everybody can actually lend their voices to an incredibly important topic that has almost fallen to the back burner of a world that is very distracted at the moment.
Distracted and in many cases dealing with real questions of debt.
Yes.
And one of the questions is really, as PEPFAR continues, and again with an eye on 2030, I know it matters to you how to think about between now and 2030 and PEPFAR and so on, and the importance of sustainability, both in programs and finance. How do you think about that in Namibia?
Namibia might be different in this regard. Namibia's macroeconomic fundamentals are quite strong, and how we manage the public purse is fiscally prudent to the point where we finance the majority of our public health response, which is not the norm. Secondly, we're one of 6 countries, African countries, who have reached epidemic control on HIV. So between the self-funding, between really incredible numbers in terms of getting people tested, treated, and virally suppressed, I think Namibia is a bit of a shining example of why the PEPFAR reauthorization is important, but also why domestic financing around public health issues, particularly the HIV response, is also important. So the sustainability question comes into play in a country like Namibia. This may not be true. I mean, if we're talking about debt, there are countries that we know right now who require IMF bailouts and with all good intent do not have the capacity to self-finance domestic response. And the financing plans for that response will be different for a country like Namibia. So it's not a one-size fits all, but I think the fundamental point is that the PEPFAR reauthorization is important for the continent.
It's crucial for the continent, and there's almost nothing that is a one-size-fits-all for the continent. And that's one of the virtues of the continent, the diversity, the dynamism, the different elements, and how different responses, including to HIV and AIDS, including children or not, because there are places where children are not a priority in the global response or sometimes the national response to HIV. Thank you very much. Dr. Weeks, Bill, as I said kind of in the opening, we're at a stage where I don't know that we can achieve our goals without remarkable innovation and improvements. Some of us, well, I won't even do that. I do not understand artificial intelligence. I am so hopeful you guys have ideas and solutions, ways in which to leverage the provision of services, the improvement of services, the availability, including for kids and marginalized populations in resource, the phrase is resource limited settings. Can you just talk to us about, the applicability? What can we be excited about, those of us in global health and wanting to provide services in those kinds of settings and so on? What can we be excited about AI, and what can we learn from you and your colleagues and others?
AI is something to be excited about, and you are not alone in not understanding how it works. There are lots of people who don't understand how it works. And indeed, I think most people consider that AI was invented with the release of ChatGPT last November, which is kind of not the case. Every time you use kind of any algorithm, AI is kind of involved and has been for quite some time. How can we actually use it to help healthcare in resource-limited settings? I think AI can be tremendously helpful in kind of expanding the provider workforce. These resource-limited settings don't necessarily have a very robust and strong and large workforce for providing health care. The way AI could be helpful is by bringing to community health workers and less kind of advanced practitioners information on what would be the next best thing to do from a diagnostic perspective or from a treatment perspective. Further, I think the AI algorithms that could be developed could identify people who are at risk of going off of their medication regimen, who would then become a risk to others, right? So if you can identify those people early, capture them back in, you've done good in preventing the further spread of HIV. And I think finally AI can be, Brad Smith, our president at Microsoft, wrote a book called Tools and Weapons. These can be tools and they can be weapons. They've been weaponized in a way with application to disinformation. And this is something you were talking about earlier about stigma, which is largely disinformation driven. It's not science driven, it's disinformation driven. So can AI be used then to combat that effectively, to combat misinformation, provide accurate information to people so they too, not just in a healthcare context, but in a general societal context, maybe make better informed decisions about how they treat others?
That's really interesting and helpful. The first point particularly around a sort of multiplication sort of effect in terms of expanding healthcare workforce. That, my goodness, if you guys really can help, if that's possible to leverage AI that way, there's a Nobel Peace Prize, I think, out there for you, because it is a huge. We have less than full force health delivery systems in a number of countries. And so that is truly exciting. The issue around stigma, in many respects, what you said is absolutely true in terms of it being misinformation, but it's also culturally driven. I mean, it's either faith values or other cultural values. Do you see AI having an ability to positively sort of change people's minds? It's not necessarily disinformation, it's a point of view. And I'm fascinated at the ability potentially of AI to change the conversation or to open up people's ideas and minds a little bit about the other, because there's a tendency, they're the other, they've got the virus, or they have a lifestyle I don't approve of, or something. Stigma is really a pervasive and a perverse underlying factor in HIV and AIDS.
Yes. So I'm hopeful that that's the case, that we can, not to manipulate culture or manipulate how people think, but to provide evidence. So again, people can make kind of informed decisions based on on reality, though. It kind of reminds me of the Ryan White story in America many, many years ago, right? Where there was all the same stigma, it was the same kind of thing. And you say, but here's this kid who got this, and how did that isn't right. And I think that transformed kind of how people began to look at AIDS, at least in America. And so one might hope that there would be examples similar to that that could kind of appeal to people's sense of humanity and fairness, and say, yeah, maybe maybe I should begin to think differently. So I'm hopeful that AI could be used in identifying or intervening with disinformation for sure, identifying opportunities to expand kind of a more balanced understanding of what the realities are in a little more scientific base perhaps, and then encouraging that, facilitating kind of the spread of that kind of more positive objective information.
I'm going to ask this question of you, Bill, but also Dan, you might want to pick up on it as well. I'm going to say this slightly provocatively, just to make the point. It's not provocative. It's simplistic because of the time. AI is being developed and generated sometime before November of last year. Very Western. Not to say Silicon Valley or Europe. I think we're in a period where we want to decolonize a certain amount of thinking and approaches and decision making. Is AI another Western innovation, invention that's going to be applied to others, or is there a danger of that, or are other perspectives, North American, non-European perspectives, how do those perspectives find their way into the continued improvements around AI and what AI is capable of doing?
Yeah, my sense is that for the kinds of things I've been talking about to be effective, they have to be provided and influenced and captured by the culture that's going to be using it. The nice thing, it's a tool. It's not necessarily, just a Western tool. It needs to be culturally inculcated to be useful to that population. And that's kind of a big difference, I think, and again, hopeful for me as you think about healthcare in general, where if across the world, most studies that recommend the next best thing to do are based on studies of people who look a lot like me. And it may not apply to other groups, right? The next best thing may not apply to other groups. So by having the culture and the people in a particular country understand and include their own data in thinking about what the next best thing is, it can be kind of targeted to that population, almost personalized and individualized for a particular population, so they can get the best out of what is available for the next best step, as opposed to just having a Western approach.
But who does that then in a particular setting, in a particular country? Is it an activist community, or the private sector, other partners? How might that happen?
Yeah, to me it's a public-private partnership with a multiplicity of groups involved, including the people who are going to be potentially the beneficiaries of AI. So you have people, private like Microsoft and EY, public interest groups, not-for-profits like yourselves, and then governments all working together. And I think it's so complex and so challenging, that's the only way to go forward.
Cool. Dan, could you?
Sure, absolutely, and I think it's the right question. We like to say that AI, or there are two worlds that we kind of live in. There's the world that we wished we lived in, the world that was ethical, the world that was unbiased, the world that has principles and is truthful. And then there's the world that the data would show we live in, which is biased, is underrepresented, of very vulnerable communities, is sometimes hateful. The AI that we have today is trained on the world that the data shows us. It's not trained on the world we want it to be. So there's a lot. Organizations, companies that I work with, are putting in place programs, they call them responsible AI programs or governance programs, to make decisions of how you use the data, how you use AI, what data you collect. And these are all really important before you start using it. We at EY, we say building AI with confidence, and that is confident that we're going to be comfortable with the output that it gives. I agree with Dr. Weeks, it needs to be localized. And one of the ways to go about that localization process is to actively engage and upskill the workforce, the people in the field of how these systems work, where their vulnerabilities are, and how they should use them and what they should use them for, as opposed to just using them as this blanket system.
We talked in the back a little bit about two things that are particularly important from our point of view and in moving closer to an AIDS-free generation, which is the leveraging of AI to improve services, and I'm intrigued with what you said, Bill, about anticipating fall off in treatment or something like that, particularly for kids and young people. And then the question around stigma. Dan, can you comment on both of those two?
Yeah, absolutely. I'll start with the first. As Her Excellency was describing the campaigns that are happening in Namibia, one of the biggest areas that AI is being applied in today in the corporate world is in the place of personalized marketing. It is being used to be able to rapidly build much more unique and tailored messages for individuals. Now, in this case, it's often to advocate for a product or to try to influence a decision of what to buy. But this could very easily be extended in driving better education and better moments of care within the healthcare setting. So we call that, the way that, as Dr. Weeks was describing, the way that we can multiply the workforce, we think that it should be called augmented intelligence, not artificial intelligence. Artificial intelligence makes it seem like we're trying to eliminate people's work or we're trying to recreate the way humans work.
That's a good point.
When really, this is about giving one healthcare worker or one field worker a tool that allows them to be able to perform the same amount of work as 50. And for many organizations, that's very appealing. It's very exciting. So one systemic thing that we see in the corporate world that I'm just going to take the liberty to share, Chip, is that many organizations are kind of caught. This ChatGPT and this AI has been so exciting. There are 1,000 startups every month that are focused on this. There's a lot of hammers looking for nails right now. What's the companies that are using this technology the most successfully are taking more of an end-to-end systems view. They're looking, if I stretch out my value chain, where are the couple of areas that I can reimagine the way that I do my work, not just give a tool to somebody. And I think from a healthcare perspective, there's a lot to learn from that, because I imagine, and I see this, one of the areas that is getting the most amount of funding and the most amount of startups is in the healthcare space. So there will be a lot of hammers, but really looking across the system end to end and finding the 3 or 4 interventions that can be put in place to be able to drive better outcomes, in this case for children, is it much more of a top-down thinking that is often missing as people are getting fascinated with the AI craze. And then the point around stigma, I think we need to flip that. I agree. Part of that program, part of setting up AI to be ethical and to use it on a principles basis has got to involve fighting against that stigma that often happens. So that has to be one of the key principles that get baked into setting up AI in the healthcare space.
I wish you luck in a small campaign to change artificial intelligence to augmented intelligence. That just seems crystal clear that it's an improvement, and I think we all recognize the world in which we live needs augmented intelligence these days, so I hope that can happen. I'd like to ask each of you to comment. We talk about resource-limited settings, we talk about health systems that don't have all the resources. Organizations like EGPAF that are delivering services and so on also have very finite resources and remarkably probably be shocked at the small percentage that's actually unrestricted. At the same time, we want to take advantage. What's your advice to an organization for EGPAF or an organization like EGPAF? How do we take advantage of this? What should we be thinking of doing in terms of helping to apply AI to the field of closing equity gaps for children, including and specifically around HIV and AIDS. Are there any obvious things? If you were me, I'd be thinking 1, 2, 3, and I'd welcome your free advice.
Yep. I can go first, and then we'll go down the line. The technology is very exciting, is very powerful, has the ability to augment, but what will help close the last mile is not going to be the technology. It's going to be the courage and the commitment to actually rethinking how we engage in the healthcare process today. So Chip, my take would be, many in the private corporation space probably are not as aware or not as connected to this. I learned a lot in preparing for this panel. But if you were able to capture the 3 or 4 interventions that we think could make a big impact, or work with people that are skilled in that space to be able to identify those, I think talking about the interventions that can be made will generate a lot of excitement from the community. Because what we find, we have 400,000 people at EY. They are excited more than ever to be able to use their skills to be able to apply it for purpose. So I think there's a huge community that's untapped that would be excited to work in helping to solve this last mile problem.
Interesting. Thanks, Dan. Bill?
So my advice to you would be to think. Don't jump on the first shiny object. To think particularly about the workflow. So often in healthcare, you see people come up with all these cool things, and all you need to do is totally change the way everything currently works, and it'll be wonderful. That isn't going to happen. It's not going to be adopted. So implementation science is really, really important. Understanding what will have the biggest effect, where, and outline that in anticipation of implementation, and then test, see if it actually works. Engage the community, make sure the community wants to embrace this, because there too, if they are not interested, it will not happen.
Excellent last point. We often get fixated on supply, and we forget about demand.
Yeah.
Genuine demand and costed and funded demand. That's a crucial point. Madam Kingos?
For the technology to work, the data must work. And maybe what EGPAF can really look at is the data sets in the countries that you operate in. It's very difficult at the moment to get disaggregated data. And to start fixing that now, before the technology is applied, will be critical.
You read my mind. We're out of time. Please, I want to thank Cordia for thank you for being here. I think it's a great conversation. We learned a lot. I'm glad to know you picked up a few things in preparing for the panel as well. Thank you all for being with me.
Thank you.
Thank you.